inflammatory effect, the distorted visual field all of a sudden shrinks back to normal, and the visual acuity and visual clarity is automatically just like within 30 seconds to 1 minute, all of a sudden the clarity of their vision looks like if someone just cleaned your glasses and put it on. It's just like 720 to 1080. Did I say that right?
That's great.
You guys went from regular standard definition to high quality, high definition. And then all the inflammatory pain in the joints all of a sudden starts feeling better within the first 30 minutes. And by the time that they leave after like 30, I watch them for the first 30 minutes. And then their joint starts to feel better and less squeaky and less pain. So a lot of my patients that I apply this for is because of the pain management and inflammation. And within 24 hours, they report back that it's like they feel much better. And so if you look at this in ancillary benefits. But my scope of practice is head and neck, and trigeminal neuralgia is right smack into exactly what it is. My scope of practice is mediating pain and inflammation. Now the interesting thing is, if you look at this, it says skin is changing, mentally sharper, I don't need the coffee anymore, discomfort, feel muscular now, or I just ran a 5K race, walking better, I canceled my ortho appointment. I have 2 friends ready to interested. Anyways, today's interesting. Today, no pain, lots of energy, lost inches. I'm getting my muscle tone back. Hold on a second. By the way, sorry, that's okay. And it says normal. This is my TN patient, a TN2 patient, and I couldn't sleep at night, much less during the day. It says perfect. It says thank you. This is the same TN. I'm sorry.
I kind of missed your premise. Were all of those comments based on an injection of their face?
Yes.
Well, face only.
These are all. I do not apply the injections anywhere else other than the oral cavity.
But they had all these other effects just from that one injection.
That's correct.
Excellent.
And so when people ask us like, how come it's affecting all those areas from an oral injection? Well, I think it's the cytokines traveling through the lymphatic system, which is like the body's kind of trash chute, and it moves very, very quickly. And again, there might be some neuroendocrine pathway, but I have a feeling that it's the lymphatic system that's making it move very, very quickly. Yes.
Mark, was that you asking that question?
What's that?
Was that you asking
Yes.
that question?
Well, that's why I was surprised that it affects the rest of the body.
Yes.
Oh, yeah. May I interject?
Yeah, please.
I attended a stem cell talk presentation to better understand this emerging field, and it was given by, it was called Body Pro, and they're in Santa Ana near the Costa Mesa border. But anyway, it's a chiropractic office, and they're offering the stem cells and talking much like Dr. Callahan, but this particular practice was licensed for chiropractic, and there was an OD doctor there. And they offered another therapy in addition to localized treatments in the joints, that they would systemically introduce it into the circulatory system, so making, how would you say it, but into the veins or into the arteries, which would be for MS. Would you comment on that?
Yes. First of all, the intravenous introduction of stem cells is not FDA approved. And so if you do that, but you just take cautiously, obviously you have the right to do what you want to do, but just be mindful that it's not something that the FDA really likes.
Why would it be necessary to use an IV if it was so well sub-Q or?
Exactly.
Makes sense.
Yes.
So are you injecting it directly into the pain spot itself, or are you injecting yourself as
I'm injecting it subcutaneously directly on the DN side.
On the DN side, but not right at any location?
Nope,
Okay.
no.
It goes through the compound.
Exactly. So stem cells has the ability to basically cross the blood-brain barrier. So bone or anything within your body is just like, it's just like a ghost. It just kind of just goes through wherever it likes to go through.
If this is not FDA approved and it's not, paid by insurance,
That's correct. It's not FDA approved for any specific treatment, and that's why insurance companies have not made policies in terms of doing
I'd like to interject. Please.
reimbursement.
It is, actually, cord blood is approved for hematopoietic stem cell reconstitution.
I mean, what stem cell, you had 3 of them, right?
The cord blood.
Yeah,
I only use cord blood. I don't use any other combination.
that's been approved?
Cord blood's been approved for one use, and that is for hematopoietic stem cell reconstitution. And what that is say you have some kind of blood cancer.
Oh.
So they wipe out your blood and they give you this younger cord blood to reconstitute. And that's what it's approved for. And anything else is off-label.
That's right.
Well, and I asked my doctor for a B12 injection, he said, I can't do it. I mean, there's commercial people that do it, but my doctor's, because he's with Kaiser, he says, no, I can't do it.
That's usually used for anemia. It's a certain type of anemia, the B12.
Yeah, but I didn't have it.
Dr. Callaghan, we had a question here about the cost. Would you talk about that?
Would you be able to share when you went to that chiropractic,
What they were?
what they were doing? I just wanted to have
Any context?
I wanted to have a reference of what they were charging for the actual stem cell, which, by the way, they sourced exactly from the same company.
They do?
So please, would you mind sharing?
No, not at all. That's what to be able to share with all of you, I wanted to find out this information. And so this particular practice was suggesting, they maybe could modify a little bit, but in the vicinity of $5,000 per cc, which is one dose, as Dr. Callahan was saying. And they primarily put it in a joint or a knee, but when you think about it, you might have a $30,000 to $50,000 knee replacement, and then you still have the copay and all of that, but here you have a healthy knee and not all the problems. My cousin almost died of a knee replacement. So $5,000 is about what they were recommending. Does that could be the context?
That's about right. So again, a lot of the clinics, mostly pain, joint clinics. I've been seeing on Facebook and all these social media places in terms of clinics that are offering stem cell treatment, but mostly for joint pain and back pain, chiropractic offices, some of the surgeons for the knee surgeons, or the orthopedic surgeons, and it's been around that. But I don't know if you guys have gone to your neurologist lately, but or oral facial pain specialist, but most of their cost is related into the diagnosis and workup and follow-up and everything like that. And I'm willing to bet that you guys are probably been paying around $2,000 to $3,000 just for the workup and the treatment. But the cost of the treatment is really based on the actual cost of the actual cell to go ahead and harvest it and freeze it, which by the way is kept at -80 degrees Fahrenheit, and packaged it and then sent to the office. And on top of that is the actual workup and diagnosis and follow-up of the case. Now, how often do you have to do this? Because I want you guys to have a sense of how often am I going to have to do this and like that. So immediate sources of when I inject it, from 30 minutes to 2 weeks, the anti-inflammatory effects are you can see it. All the way up to 2 weeks, the cellular processes and the cellular repair starts happening, all the way up to 2 months to 3 months. At 3 months, I go ahead and reevaluate and see how far along you are. Now, my 21-year sufferer is still pain-free after almost 2 months. And she's doing really, really well. And we reevaluate her again at a 3-month mark, and we'll see where she goes from there. I really think at that 3-month mark, we'll have to kind of see if we have to do another CC again. And so in terms of the cost, again, they're like around $5,000. So I'm thinking that if you have to continue care, I think the initial cost will probably be what is going to be expensive, and I think you're anywhere between the $3,000 to $4,000 mark in terms of the initial care. But each additional one, I think the cost should actually decrease as you actually need to do more. And so I think for most patients, it's really difficult to justify. It's like, oh man, I got $3,000 to $4,000 per CC, and then I got to do it another 3 months. I got to do another $3,000 to $4,000. So I think most of the cost should be somewhere in the beginning of it, because there's just a lot of the workup and the follow-up and everything. But each additional one, let's say 3 months from now, or 6 months from now, or a year from now, should actually start to decrease, because it's kind of like a frequent flyer plan. And so I guess the more you use it, actually, the less it should get. And so, but we really, at this point, we really don't know how many times we're gonna have to use it. But for the 21-year sufferer, it was worth every penny, because not just her, but her mom basically said, oh my gosh, my prayers have been answered. And she happened to be a Catholic also as well, since she kept on going to church every single Sunday, and just prayed and said, thank you, thank you, thank you. Because as a parent, the worst thing is seeing your child and you can't do anything about it. But
You also have to compare to the cost of microvascular decompression surgery. Now, I know we're mixing here TN1 and TN2, but
Yes.
you can also prolong and help your body, depending on your age, there's always all these variables. But a microvascular decompression surgery, which some TN2 patients do undergo and do experience some pain relief, those surgeries, I thought they were $30,000. I was told, but they're upwards of $50,000 and to $100,000. So it depends on your insurance. But even if you're taking 20% of those really large numbers, that's a lot of money.
yeah. So, but if you have to ask me, it's like, what's the initial cost? I think I'm thinking, depending on what it is, it's probably around $3,000 to $4,000. And I think the next, if you have to go another dose, I think it'll decrease, because so that it just makes it much financially less burdensome for you. And if you have to do it in another 6 months, it'll decrease the cost also as well.
Are you finding that insurance companies will pay for this, or you know, it's pretty out of pocket?
It's out of pocket right now, because insurance companies will not create policy unless it's FDA approved.
Okay.
And they don't want to pay for it. Now, the interesting thing is, there's some private insurance companies that are offering insurance policies for healthy people that are relatives of sufferers that may be in line for having something similar to this. And so they're actually buying similar policies, just like buying an insurance policy for your child or something like that. And they're running in a cost of about, there's like an initial payment for maybe like $1,000 for the initial setup, and then like a couple of $100 a year. And it's just kind of like a plan if you stored your cord blood and was offered an option right when you have the baby to say, would you like to store the cord blood of your baby? They'll have a setup fee, and then like a $200 for freezing fee, and then that's not including the processing fee to go ahead and turn it into a usable cord blood product. Go ahead and do that. But it's really interesting that private insurance companies are starting to offer this. I think it's called Stem Cell Plus or something like that. Yes.
So, each birth is not harvesting the
No, they have the option, obviously, of, keeping it for themselves, donating it, or dumping it.
So if you donate it, if there's, because my daughter-in-law's pregnant, when I told her she has to save it.
Of course.
So it, does she incur a cost for actually having it, or can you just, if you donate it?
There is no cost for, I mean, I don't think there's any cost for donating it.
Yeah.
Oh,
They just sign off that says, go ahead. It's just like,
is it something everybody's asked?
I think so. You know what? My wife is a neonatal ICU nurse at Home Hospital, and so, would you be able to answer that?
The company is Viacord, 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 and you do pay you pay for an initial fee, I think roughly $2,000. But in case your child needs it, you can use it.
But not if
It's
you're
like a
gonna
shelf
donate-
life.
If you're gonna donate it.
If you don't, you can also, because a lot of it is really, when, a lot of them are getting thrown away anyway. It's a waste, it's a body waste.
Yeah, no. that's
You know, that's the normal thing in a hospital. How many, like in my hospital, we're going 700 births now. There's a population, or maybe because of the area. We came from a 200 births a month to now we're like tripled it. So actually the Hogue is thinking of opening like, well, child births because we're the influx in labor. and
But there's no
delivery.
cost to donate it.
No cost to do
Oh,
that.
great,
Yeah.
thank you.
No cost.
Yeah. So, but anyway, I just wanted to kind of tell you is that, this is my 21-year sufferer, that it's a sensation in my head, left when you had excruciating pain, it's left like before. It's just, she basically had a really good night's sleep. I don't have my sleep apnea mouthpiece, and I woke up energized, which normally I'm dragging. So it really mediates this fatigue and the pain and the inflammation. Still no arthritic pain, lots of energy. It seems too good to be true, and I wouldn't believe it unless I actually physically asked my patient and then I witnessed it myself. And so,
How are you feeling now that you took it?
I am also a beneficiary of the stem cell treatment myself, and so I wouldn't recommend it to anybody unless I actually did it for myself, did it for my mom, did it for my dad, did it for my sister, did it for my brother-in-law, did it for my wife, did it for all my aunts, and about 60 to 70 patients of mine.
I've done this one.
Oh, and so I suffer from a lot of inflammatory issues and people diabetes. And
Well, as you know, I did it too.
well, I didn't want to say anything, but
I was kind of reluctant if I should or not, but since we're open in this medical support group and what we stay in here, what we exchange with each other, and I've had a host of health issues my whole life, and the one amazing thing is the arthritic. Here you injected just like a tooth injection. You don't feel it. You numbed me, and you told me I might have a little brain freeze. I had no brain freeze, like you eat a popsicle or something. I had none of that. It was just very eventful. I went home, but you feel your circulatory system moving. It's kind of like maybe you had a little too much coffee, but not that, like coffee you feel hyped up. It was just like you felt your circulatory system moving. And I think for me, as a TM patient, we have all these different pains, and you know, I had neck issues a lot for various reasons. When my pain was so bad, I had this tendency to go like this. And so I developed a lot of severe neck issues. Well, my neck issues are better. And I'm suffering with some other condition, another condition that I don't know how it's affecting it. But I was also beginning to have twinges of TN on my other side, which all of us TN sufferers, Jen knows, we just cringe because you know what's coming, you know how the progression, you know what the treatment options are, and they'll follow that. Well, I must admit, it is better. At least it hasn't come back. And, so, you know, none of us knows, none of us are going to live forever, that's for sure, but we're trying to be as comfortable as possible. So, that's my story.
Thank you for sharing. Now, also my mother and my father has COPD. And when we do stem cell therapy, a lot, 80% of that, the ones that were done intravenously, that FDA doesn't like, and I don't personally like. I think personally, I think the intraoral application is just as effective, if not better, than the IV application. That's just my own personal opinion in terms of what I've seen. And I've witnessed IV infusion of the stem cell, but when they do that, 80% of it goes directly into the lung because the circulation goes through the lungs. But I did, my father, who has COPD, and I did an oral injection, and he can barely make it up the steps without having labored breathing and just kind of like just puffing like this to increase his lung capacity. But after about 6 weeks of the injection, the man just goes up and down the steps without any issues whatsoever. Now my mother has neuropathic pain in her fingers, and she's 87 years old, I'm sorry, 78 years old. And she would pick up things and then drop it because of the tingling on her fingers. But she's now done on her second application, and she has no more pain in her fingers anymore. And she brags how flexible she is and how to be able to do that. And I always warn her, because Mom, please don't do anything beyond what the cells give you. And if you're not a ballerina, don't do ballerina splits. But the tendency of my patients is like, wow, I have this mobility, I have this ability to do this now, is to go above and beyond their limitations. And I always warn them, it's like, please don't go above and beyond your limitations, what you could have done when you were suffering from these things. But anyways, I wanted to share with you the actual application. This is a medical director of a chiropractic group, and so he